We are following the measles epidemic every day. We're watching it. We put out a post on it yesterday, and we're going to continue to follow it.
And welcome back to Square Off. Health and Human Services Secretary Robert F. Kennedy Jr. downplayed the measles death of an unvaccinated child in Texas as something that happens every year. In fact, it was the first death in 10 years. So is Kennedy up to the challenge of dealing with a public health crisis if one happens here in Arizona or Texas or anywhere else? Our next guest says the Trump aide he's concerned about is Elon Musk, the world's richest man and presidential aide. Joining us now, Will Humble, former Arizona Public Health Director, hired under Republican Jan Brewer, still involved in the public health field. Thanks so much for joining us.
Morning, Brad.
Let's start with Bobby Kennedy. Maybe because of COVID, we expect leaders in HHS and all subsidiary agencies to lead us. Is he capable of leading us through an epidemic, let alone a pandemic?
So epidemics like what's happening in Texas and what would happen here if measles leaked into Arizona are really led by county health departments. I mean, that's where the rubber meets the road, at least in Arizona. County health departments are the folks that are responsible for responding. Now, the federal government funds a lot of that, in fact, almost all of it in Arizona, and they provide some leadership and guidance at CDC, but the actual work is really with the county health departments in Arizona.
Okay, and so let's bring this back to Elon Musk then, because you say Elon Musk and his DOGE guys, bros, are the people to watch. Why Elon Musk?
Well, if you remember back to the very beginning of the new administration, one of the first things that they did through DOGE, but then through one of the federal agencies, is tell all of a whole bunch of government agencies, including CDC and others, to tell their contractors to stop work. Well, that means all of the grants, all of the money that pays for county health departments from the federal government was shut off for about, 12 hours. There was a temporary restraining order, and a judge said, you've got to stop that for now. But the big issue is that our county health departments are almost completely funded with federal money. And if that shuts off, which it did for a few hours, the judge stopped it, we don't have health departments, basically. And so we're totally unprepared.
Whoa. What about your old agency, Arizona Department of Health Services?
That's almost all federally funded as well. So the way it works is the federal government gives the money, not gives, but has a cooperative agreement with the state health department, who then forms contracts with the county health departments for deliverables. So that flow of cash from federal to state to local health departments, that's the key. That's what keeps public health running in responding to things like measles. Well, if the judge lifts that order, that money gets shut off, and county health departments don't exist in our state.
And what's going on in county health departments and the state health department right now?
Well, they're drawing up contingency plans, and they're telling their county managers and county supervisors through memos and so forth, what the risks are. But they're pretty much freaking out because anything could happen at any time, and they would have to do mass layoffs and end their health departments. I mean, it's literally 80% of the funding that county health departments have come from the federal government, and much of which gave a stop work order, which was then stopped by the judge.
And we're waiting to hear what the courts decide, excuse me, and also what Congress does with a new budget. So right now, if we were hit with a measles epidemic, would we be okay?
I think most counties would be okay. I mean, some of the really small counties with some of these counties have a health department staff of 30, something like that. So they do cross-training so that if they had a measles case, they have a group of people that can go out and do the contact tracing and so forth. A lot of the small counties need assistance from the state health department if they have an event that they can't manage. A place like Pima and Maricopa County with a lot of staff, they would definitely be okay right now. But it all hinges, by the way, with these measles outbreaks on finding the first case really fast, because it's so contagious. If you don't, it's like a wildfire, red flag season, with wildfire. You have to find that first case fast so you can identify the unvaccinated people around that person, exclude them, put them on quarantine. That's the only way to slow down a measles epidemic. And I think in Texas, they're out of there. I mean, it's gone too far already.
I was going to ask you, I know you're not there, but do you think they've done that or are able to do that?
I think they missed the early cases. and or didn't intervene and do the contact tracing and the quarantine that was needed to stop that envelope of unvaccinated people around that initial case. Otherwise, you wouldn't have, it's a couple hundred now. By the time, this time next week, it could be 400. I mean, it's the most contagious disease that we know of.
My goodness. Let's bring it back to RFK Jr. So what are you concerned about when it comes to his management of health policy, other issues?
Yeah, and we talked about this a couple months ago on the show. My biggest concern is that over the course of time, Mr. Kennedy has not shown a commitment to using the scientific method and peer-reviewed, evidence-based literature to drive his opinions. And now he's got power of the state and control of 30% of the federal government. Those HHS agencies are 30% of the federal government. And now you have a person who over time has not shown a commitment to using evidence to drive his decision-making. That's my primary problem with Mr. Kennedy. Now, I do have specific concerns about his attitudes on vaccine and now the authority that he has through the CDC and the FDA and the recommended schedule for vaccines. I'm concerned that that is going to have a problem over time. But my most immediate concern is what we have been talking about with this money that could shut off at any moment because of the actions of DOGE.
All right, got to end it there. Will Humble, very bracing interview. Thanks so much for joining us.
All right, take care.